In today's video, we are answering your questions on and related to the COVID-19 vaccines, with a special guest on part 2 in our series, interview with a medical professional on COVID-19, Nurse RN Kim Moore, Educational Coordinator for the Los Angeles County Vaccine and Preventable Disease Control Program.
Hello, everyone. My name is Acosta, here back again at the Watts Community Wellness Channel. Today, we're going to be talking about the vaccines. There's a lot of information out there. I know it's been very overwhelming. It's overwhelming for me to be informed. So we've done some of the work. We've also brought an expert in, and hopefully we'll be able to provide you with some of the answers to some of the questions you may have. So I'd love to introduce our guest, or have her introduce herself if you'd like.
All right, good afternoon. Thank you for having me. My name is Kim Moore. I'm the Educational Coordinator for the Los Angeles County Vaccine Preventable Disease Control Program. I've been in immunizations, working with immunizations as a nurse since 2008. I also work at the MLK Public Health Center in urgent care. I've been a nurse practitioner since 2008. So 12 years, I guess, 11 years, 12, 13 years.
Yeah. Well,
so thank you for having me.
Yeah. Well, first off, thank you for your time and thank you for your work during this time and taking the time to help us educate the community. I know this has been a very, very tough time. So as we discussed, I kind of want to start off with one of the biggest questions and comments that we've heard. And I'm actually going to just kind of read it because it was something that was said by the community, but I'm not getting the vaccine because I'm more likely to recover from COVID-19 than to be covered against it. So that is something that we've heard. I'd love to start off with addressing that one first.
That is an excellent question. Like the COVID-19 vaccine, like all the other vaccines, they imitate, when we receive a vaccine, it's imitating us getting that virus, where the virus gets into our body and triggers our immune system to produce antibodies so that when our body comes in contact with that virus again, it will protect us. So hopefully we don't get sick again. So the advantages of getting the vaccine versus getting the natural infection, you won't have the complications with the vaccine. Complications such as why people are hospitalized with COVID, loss of taste, smell, death, ending up on a ventilator, unable to breathe, all those complications that come with COVID. You take that risk getting the virus, the natural infection. Excellent question.
Yeah, I really appreciate you saying that because that's why we're very honest in this channel and stuff. One of the challenges that I had was with my mother wanting to be vaccinated. And I know some of the things I know she had heard that. One of the other ones I'd love to discuss is if everyone else gets vaccinated, why do I need to get vaccinated?
Sounds like you're sort of talking about herd immunity. Well, herd immunity is when you have a large population, a large percentage of the population getting vaccinated. Now, in order for herd immunity to occur with the COVID vaccine, 70% of the population would need, it's estimated, 70% of the US population, that's more than 200 million people, would have to recover from COVID-19 to halt the epidemic naturally. So herd immunity can occur, but it takes 70 to 80% of the population to have some form of protection already. And really, herd immunity is for those, think of it as a way for those who can't get vaccinated. Everyone can't get vaccinated if they have certain immunocompromising conditions, they have had a severe allergic to that vaccine, and we want that immunity for those people. And also, if we were trying to do a natural infection and develop herd immunity, that could be very dangerous, as we've seen with our hospitals being overwhelmed. If you get that many people sick at one time, and we have seen that, when they say surge, that means all of our resources are very limited. So this is what the whole distancing and staying home, because we don't want to see those surges. That can be bad. I've witnessed one on firsthand. It is very scary. You may think you're young, I don't have to worry about COVID. But let's say you happen to trip and fall that day and you have to go to the ER, maybe you broke a bone, you may be waiting for hours. I'm not just talking 2 hours, I'm talking 10, 15 hours before you get seen for that broken bone. So, I spoke to our epidemiologist this morning, and we maybe have some good signs with the herd immunity because of the natural infection and the number of people getting immunized. It's just sort of a chance right now to take it, the natural herd immunity, because, people are traveling still, and certain countries that may not even have a vaccination program in place yet for COVID. So we're hoping that herd immunity will happen, but I would prefer to get the immunization instead of relying on it if I could.
I love actually going up on that. And that was actually what I was able to convince my mother with, that the concept of it is for others as much as it is for us. It really the way I ultimately saw it. And yes, knowing that some people won't be able to be vaccinated because of other conditions. You mentioned travel, and one of the things we've also heard, and I've heard, is the possibility of variations of the virus coming from other places and things like that. Could you speak a little bit more on that?
Yes, we have. Just this week, they found one of the strands. I believe it's the UK strand. But again, our vaccines, we anticipate most viruses mutate. So we anticipate that virus is going to mutate. And if you compare it to the influenza vaccine, every year they may change the makeup of that vaccine to match that current strand of the virus that's circulating. So they're ready for that. They're not afraid of that. And currently, keep in mind, the research is still new with COVID vaccines. They are showing that it can handle the mutation. Some of the vaccines can handle the mutation, and they're not afraid of mutations. If we have to, we'll do a new mix of vaccine. It's all, they know they pick out the certain genes and in the laboratory to protect, to create the best vaccine.
Would it be accurate in saying we're kind of trying to outrun the virus, like us, the human species get stronger and vaccinated before the virus can outmutate us and our vaccination? Would it be incorrect in kind of saying that? In the idea, in the way I kind of thought about it, is, and and kind of things I've also heard, if we don't reach herd immunity, and viruses are allowed to exist for long enough, they may grow stronger than our vaccines are able to keep up. Is that something that could be possible? Or
I think, we live in a great time with technology, and our scientists are super smart. I just think they'll create another vaccine to match it, because they study the genes. They know the gene makeup every year, because I usually give presentations on the flu vaccine every year, and always, hear someone tell, even at work, sometimes in the clinical setting, I'll hear a staff person say, "Don't get that vaccine. You don't know what's in it." Yes, you do. You can look it up and Google what's in it. So going back to my point, if it mutates, I think our scientists are ready, because a lot, the flu, that's why we have to get one every year, because there may be something new circulating. They're ready. I believe they're ready to handle the mutations as they do with the influenza.
That's great to hear. Yeah, I really appreciate
they
that.
Anticipate and expect, that's what the viruses mutate to survive.
Mm-hmm. I know we discussed kind of the flu, and that was another thing that was commonly said. Can you kind of give us a little bit, just the most simple explanation? And I mean, one thing we could point out is the yearly death toll, as far as the difference between influenza and COVID-19. There's been a significant discrepancy between those two numbers. Can you speak a little bit more on what also makes the virus so deadly, really?
Yeah, COVID vaccine or the influenza?
The COVID,
COVID.
like COVID compared to the influenza.
Oh, the death rate and the death and illness rate is way higher than the influenza. And I'm sorry, I don't have the stats in front of me right now, but just from what's happening in the community and all of our attention in public health, most of us have all been assigned to work on COVID activities. This is our top priority. We didn't even have a discussion about flu this year. So, and this is pretty serious, a pandemic. Our last pandemic of 1918, this is worse than that. If I remember correctly, 1918, we lost 650,000 Americans. Our number, I believe our numbers are going to surpass that if they have not already, as far as the deaths from COVID. So it's pretty high. We call it morbidity and mortality, death and illness is bad for COVID because it's so sudden and it's new and they're studying. The research is ongoing and we're doing a lot of research to determine why some people have symptoms, some people don't have symptoms, why some people are affected severely and some not. There are some risk factors that have been identified as far as being at risk for COVID. If you have a chronic illness, if you're immunocompromised, even pregnancy. I got to work with a pregnancy in one of the COVID teams. It's really interesting. And being overweight, these are some things that increase the risk for getting the COVID-19 vaccine, COVID-19 infection, excuse me.
Can you actually speak a bit more about pregnancy and also as far as its impact on the vaccines?
Okay.
Or vaccines' impact on pregnancy?
Well, this vaccine, now, because it's new, the literature, anytime there's not enough scientific evidence-based science to show how the women, the research has started with the pregnant women and children, but, the recommendation is not there yet, and it's not against. So a pregnant woman can or cannot get it. They recommend talk with the healthcare provider. It's really up to the patient and, whatever her and her healthcare provider agree to. Because when some things aren't recommended in medicine, is because the research, they don't have any evidence based on research yet. They don't know. So they don't, want to say, oh yeah, it's safe. Oh no, it's not unsafe. But it is recommended, the COVID-19 vaccine for pregnant women, because they are high risk. And we have had some deaths of some very young women, pregnant women in LA County from COVID-19. And just because a woman is pregnant, that puts her at risk, the extra fluid volume, all the changes going on in the body, that puts them at high risk for COVID. And that also put them at high risk for influenza.
Okay.
Mm-hmm.
Thank you for sharing that, because I know that was a question that we had as far as people hearing as far as the vaccine safety in regards to pregnant women or women expecting to be pregnant in the near future.
I know it's scary. I know it's very scary. And if I can say one thing that may help, I know it's scary. What I recommend, and we live in a good time with all this technology. However, if you Google any of this information, is it safe for pregnant women to get the vaccine on the internet? Make sure you're looking at a reputable website. Don't just pull up the first thing that comes up. Look for .gov, .edu, .org, because usually they say that when you're dealing with science, .com, sometimes they're trying to sell you stuff. And don't get me wrong, I know there are some good .coms, but we're dealing with science here. And, you want to make sure there's no financial motive behind them giving you certain information. You want to make sure it's real evidence-based information dealing with stats. Someone did a large enough study so that it can be generalized to the population.
Thank you for saying that. That is actually something we're going to have a future video on, is how intense research is just in itself, and how many different things are looked into. And so not all sources are equal.
No, they're not. Anyone can put anything on the internet and make it look really official.
Right. And that was another thing I also wanted to mention. having purchased domains for my organization and everything, I know even just buying the edu ending isn't that hard to get. So even with if you see things like
really?
that,
So now
yeah.
got to watch out for the edu too. Now that edu
org, all those things now are really, really
easy to get. Oh
easy to get.
no.
You may have to just pay a little bit more than the .com or .org.
.gov? How about
But
.gov?
I
They can get
think
that
.gov
too?
maybe. No, I think .gov is probably locked off. But I know I've seen
Okay.
.edu before.
Oh
As far
boy.
as I believe.
Those used to be safe.
Yeah, really check your sources where it is. And one of the things because I did want to look up, as far as yearly deaths per the CDC in the United States from 2010 to 2020, it's 12,000 to 61,000.
From influenza?
From influenza deaths. So that would be compared to COVID, which was over 500,000.
Yeah, so you see the frenzy and the scariness of this virus, not to be underestimated.
As you mentioned youth, and that was actually another thing. You shared a story before we actually started recording. I was wondering if you'd be willing to share that story of kind of just the experience you had with that youth. That kind of wasn't, because a lot of the youth think they won't get sick.
Oh yeah. Yeah. You know, it almost it really breaks my heart when I look on social media, Instagram, Facebook, and I see people living their best lives like we're not even in a pandemic. Well, the danger behind that, and the young people, 20 to 30 age group, I believe, are the highest, have a high rate of COVID. So they're spreading it to their friends and family. The danger in that, yeah, you may be young and healthy, but if you get injured and end up in an emergency room, and if there's a surge where they're being bombarded with patients they have to treat first because they have COVID, and there are no more resources, no more beds, no more ventilators, no more operating rooms, nowhere to put you, that's when it will affect you. And we see that. I've seen that firsthand, and it's scary. I've never, again, I think I've been a nurse for, I can't even remember, since 1996. I know I need to do the math. I've never seen anything like that, where normally people bought in the ambulance or taken right in, but there was a line of people from the ambulance because there was nowhere for them to go in the hospital. So, you really have to think about this. We're in a pandemic. It's real. The 1918 pandemic, influenza pandemic, and please Google it. You can find it on the CDC website. That pandemic lasted for about approximately 24 months, 2 years, maybe even longer. And it didn't really end until the vaccine came out, the flu vaccine, influenza. So, and I had witnessed on that day, I prayed for several people that day because I had a young man come. I work in the urgent care next to a hospital. The young man came in, and he was more than what urgent care could handle. He had to go to the emergency room because he was vomiting blood. He looked dehydrated. He was sick. He couldn't walk. So I wheeled him over to the emergency room, and I was shocked to see that line of patients in ambulance. There was nowhere for him to go. And under normal circumstances, they would have pulled him in right away, maybe start CTing his stomach, trying to find out is he bleeding inside? What's going on? But that young man who was probably in his 20s, I hope he didn't die from just waiting to be seen. Because the wait time when there's a surge it's unbelievable. We're not just talking 2, 3, 4, 5 hours, maybe 8, 10 something hours. Wow. And the ambulance were just riding around with patients because they didn't have anywhere to take them during that surge. So yeah, it was very real.
And again, so for the channel, we don't share this information to scare anybody. We're really hoping to provide information to the community so that you all can make your best decision. We're really focused on wellness. So this is one of the things we come up, and one of the things that gets talked about with wellness, and the fact that being indoors has been traumatizing in its own way for many individuals. And one of the things that I've kind of discussed in that, and even I work with children specifically, and they're always kind of my priority. So I'm always thinking about them, and very much even as we're discussing returning to school. and how potentially the kids are being traumatized with the virtual learning or things like that. It kind of gets back to me where I don't know anything more traumatizing than losing a loved one. And how, as you mentioned, some youth going out and living their best life. There's been countless stories of those people regretting their actions for just one weekend of, I'm going to treat myself for this. And we very much encourage everyone do what they need to maintain their mental health, because that's very important. But these just aren't normal times. And it's just that really that understanding that we are living in a global pandemic that has impacted the entire world. And
this is history in the making, okay?
Yeah, I say that to my kids all the time. They're going to study the years of your life forever. Because just the impact of 2020 can't even count the amount of impactful and traumatizing events that happened just in, that year. So really, again, really coming back to the audience, for those who are watching, we really do share this information, not to scare, but we really do want you to be informed, because we do see a lot, or I see a lot of misinformation on the internet. And what I'll even say beyond the internet, I see a lot of misinformation on the news personally. And what in saying that, what I always mean by that is, I mean, this is a longer discussion as to how news is run now, but it's very much in the marketing business of it needs viewers. So the more dramatized or scandalous you can make something, the more likely you'll have more viewers. It's why we have reality TV as being so popular. So news has kind of become that, unfortunately, and it is not the news that people knew in the past, where it was specifically designated to just inform and provide credible information. It's really become a place where opinions and and this is another thing, as far as the idea of what a leading theory means, or what a potential hypothesis means, and the difference and significance of those between science really aren't discussed in the news. And it's just like, there's one study, and I kind of feel like oftentimes at the point, one study doesn't mean anything in science. It doesn't mean anything. One study alone will never mean anything in science. And that's where I'll see so many articles written on one study, and it's just amazing to me, because people then digest that as fact. And it's the understanding of, and this is another conversation where we're going to have a conversation on research, the idea of how much actually goes into scientific research. And I'd love for you to share kind of a little bit more on that, and just really how, so I'll actually share a personal example. So I got the Johnson & Johnson vaccine recently. And on the day I was going, I received a text where my sister was also going, that they had recently stopped a batch of the Johnson & Johnson vaccine due to contamination.
Yeah.
And so she told me kind of like, what do you think? And she let me know. And my question was, where did they find this? Because it was always it's my general belief that most companies operate off of their finances. That's a very, very big deal for them. So to me, when companies respond after making a mistake to harm humans, that's a little bit different than an organization throwing away millions of vaccinations because of their safety protocols being not met. So that made me feel safer, because that to me told me their process is working and they caught it before it harmed anybody. And they're willing to throw away millions of dollars, because I mean, I don't know what that translates, but I'm sure it translates to millions.
Well, any given day, prior to the pandemic, clinics that give vaccines could have easily $40,000 to $60,000 worth of immunization in their refrigerator. Vaccines are expensive.
Yeah.
So I'm glad we're not charging for this one, or, the public.
Right. But yeah, so the idea that yes, that they would do that gave me a more reassurance as to, and it would just kind of reaffirm the idea that I know, and that's why we're very honest in everything. There's corruption in everything. And there's also human error in everything. So we will always have both of those existing and mistakes. I generally have a collective faith in the science community that I know in science, it's really the pursuit of knowledge versus the pursuit of being correct. And I know that's a very novel thing compared to general society, because I feel a lot of science is constantly trying to prove itself wrong because it needs to prove itself correct by removing all the wheres it could be wrong. Moving from that, and so there will be a sample video, I believe, attached to this. That was my experience when I got vaccinated.
Oh, good, good.
I do want to share that so I was vaccinated at Cal State LA. I did a walk-up. Extremely easy. So I did make an appointment, but there was drive up and walk up. And so I ended up doing the walk up. Extremely easy.
Yeah, that's good.
As I've shared with the community, I'm actually someone who deals with a lot of anxiety.
Okay.
Even as much as I was, pressuring my mom to get vaccinated, as much as I wanted the vaccine myself, it didn't mean I did not exist that day without nerves. Like, I didn't eat much in the morning because I was nervous. And it was just, I got to get this done. I'm going to do it and then I'll be relaxed. But I still have I even made it an extra effort to thank everybody because it was so smooth.
Good.
Very much just, I saw the first National Guard. He asked me, do I have an appointment? Yes, he pointed me to one of the lines. They checked my ID. Gave me a wristband, pointed me to another line. I waited for so when I got into the line, one person was getting up from getting vaccinated and the person in front of me was going. So I really only waited for one person before me to get up.
That's good.
Yeah. And then I sat for 15 minutes, the allotted time that they, to make sure. And that's actually when the video took place. And I have actually been well. I did not feel anything more severe than like getting a shot. So my arm was a little sore the day of, and the following day it was gone, I believe, by 2 days after, but nothing more than like, I got a shot.
That's good. Very good.
So I know that's one thing that may be preventing someone. I definitely did want to mention that. And going on into that, I'd love for that to transition into kind of, if you could give us a little bit of an explanation between the Johnson & Johnson and which is a single dose, and the Pfizer and Moderna, which is 2 dose. Because I know, and I'll share, I saw there's a lot of memes and different things going around, and you'll see a lot of graphs that show a 90% for the 2 dose. And then you'll see something around 60% for the Johnson & Johnson. It took a lot of research to understand what that meant before I took the vaccine, because it was one of those things where I wasn't going to let a D quality, vaccine go into my mother, was really the thought. It was just, my mother's going to get what's best. And it was the research that I did that ultimately led to my decision. But I'd love for you to explain a little bit as to why those are different and why Johnson & Johnson only requires 1 dose.
Well, okay. So first off, there are 2 different types of doses, 2 different types of vaccines. The Moderna and the Pfizer are pretty much in the same category. Those are what we call messenger RNA vaccines. And it's just, the technology of that is a little different. But all vaccines pretty much, again, imitate the virus, get into the body. Your immune system creates antibodies to provide protection if you should come into contact with that virus again, so you won't get sick. So that's what all of these vaccines do. There are some subtle differences between the 2 different categories, the Pfizer and Moderna. Pfizer, you have to be 16 and over. Moderna, you have to be 18 and over. Again, the effectiveness is 94 to 95% and requires 2 doses, spaced 21 to 28 days apart. Now, The Janssen is the one dose, and you have to be 18 years of age to get that one. And that's from a viral vector COVID-19. It's called a viral vector COVID-19 vaccine. It's a little different from the messenger, the Pfizer and Moderna. They use a modified version of a different virus, the vector, which is an adenovirus, to deliver important instructions to the cell. And the adenoviruses are not integrating. They cannot replicate since the gene was removed. You know, it's done in a laboratory. It cannot, none of these vaccines can transmit any COVID-19 vaccine, COVID virus infection, excuse me. Now, you ask, is one better than the other? I know we see those numbers for the Pfizer, Moderna, 95% effective to protect you from getting sick. And then you compare it to the Janssen, which is 66.3% protection from the virus. Well, when we're in a pandemic, first of all vaccines are safe, all of them, all three of them are safe and effective. They tell us because we are in a pandemic, and the pharmaceutical companies are working day and night to get the vaccine out, but there's still a shortage, that we should accept the first vaccine that we can get our hands on. Don't wait for a specific brand. All three vaccines demonstrate a 90 to 100% effectiveness in preventing serious illness and death from COVID infection, which is great. That's our goal. And that's it. And if a vaccine, and I used to say this a lot during flu season for the flu vaccine, if you can get 10% out of a vaccine, that's considered good. 10% protection, that is considered good. So take it. And if you remember when they stopped using the Flonase for the flu for children, people 2 years to 50 years of age, they pulled it off a market for a while because they weren't afraid. They didn't think it was meeting that high expectation of protection. But then their research showed, and plus, especially when we had a bad flu season, if we can get 10% effectiveness, let's take it. That's considered good with a vaccine.
Yes, and that was the main thing that I got as far as my final decision, is that they were roughly the equivalently as effective for preventing severe side effects and death. And that's what I'm looking for. So that's where it was just the opportunity. You also mentioned youth, and I've heard there's some trials and things like that. And what I've mentioned and what I know about just vaccines, no parent is going to sign up their under 18 child to be trials.
Well, they're not true. Some people have signed, yeah.
So what I was saying, before a vaccine has even started. So that's why I was saying where adults will always be the first in any scientific trials, because no one starts with children first.
You got it.
So
yeah, that's there's different research, ethnics and principles. So we always start with the adults most of the time.
Right. So that's why I wanted to make sure that's one of the big things that's pointed out as to why it isn't applicable for children now. But I know that those that work is now in play. How is that looking? What should be?
Well, honestly, because things are changing so rapidly, I've seen the highlights, but I haven't really dug in deep to read up on what is all going on and how's it going. I know they just started the beginning of this week or last week with the children and pregnant women. Started the some research trials. Yeah.
Oh, that's great to hear.
Mm-hmm.
Yes, and that was something I know I've thought of, and that's why we do want to do that research video.
But I will tell you, and it's kind of funny because I work over at the forum, where we give out the vaccine. I am really proud of the 14-year-olds that are trying to sneak in to get the vaccine. There's a lot of youngsters, and there have been some youngsters that have got the vaccine, and I believe they're okay. But that is considered a medication error because they were too young to get the vaccine. But, there's a place you can go to look at this. Well, let's see, I don't know if they share with the public. It's called the Vaccine Adverse Event Reporting System. And anybody, you can go to the CDC website. If you think you had an adverse reaction, side effect, the vaccine did you wrong, any vaccine, You can create a report, either you or your healthcare provider, and the CDC gathers that information. And I believe I saw a highlight where someone was okay, younger than the intended age, and they based the age on the research that was done. So, they didn't have any 14-year-olds in the research, so they started at 16 and 18 as far as the age group.
I'm actually glad you brought that up, because I was recently exposed to that website, and it's usually just abbreviated as VARS, VARS.
Yeah, VARS,
Yes. So I did look into that. As we're doing in the video, and again, as we're discussing the credibility of sources, if you look on that site itself, it also says that those testimonies aren't yet vetted and can be not used as proof.
Yeah,
so I wanted to make sure.
Oh yeah, because as far as deaths from the COVID vaccine, the VAERS, they said they had received what, 2,000. Let's see, I think they received quite a bit of. Okay, they received over 167 million doses of. 167 million of doses of COVID vaccine have been administered in the U.S. since between December and April. During this time, they received 2,794 reports of deaths, which is like 0.000167% among the people who received the vaccine. They did their research, the CDC, Centers for Disease Control and Prevention, and the Federal Drug Administration Bureau, FDA, and they found that none of those deaths were related to COVID. I mean, the vaccine. I'm sorry, they weren't related to the vaccine. They reviewed clinical information, medical records, death certificates, autopsies, and they could not contribute, though, that number of 2,794 deaths reported because of the vaccine to the vaccine. So thank you for pointing that out.
Yeah, and yes, and thank you, and that's what we're going again. That the website is data, which is then used to get the calculations in the research, but and
we really, they do have to vet it and review it, and we want to hear this, because even though these vaccines are under an emergency use authorization, they're still going through the process of being evaluated, and they use this information to continue to evaluate the safety and efficacy of the vaccine. And safety is the main goal.
Right. And that's one of the things I do appreciate about science so much. It's always looking on where it's wrong.
And we love data.
Yeah. And that's one of the things so I did psychology in undergrad, but just even being exposed to that type of research where the intensity of data and the scrutiny between internal and external validity is really, really serious, that's where when I was exposed to that website and I started seeing people use it as proof, the website itself even has it like highlighted that this is just a data set that they use to then further investigate the cases and figure out what is actually happening, but that this is a raw data set that needs to be vetted and everything too. So it really is important I'm just someone who loves learning, so I fall into rabbit holes every single hour, basically. Good. So I'll go into and I'll try to figure out, okay, what's this website? What are people talking about? But especially when it comes to your health, and this is why we're doing these videos, it is really, really important to look into it. So very much we want this to be one of the tools you use. Hopefully you'll look into what we say a little further and make this decision for yourself, because it is something very important and very serious. And one of the things we do want to mention is the community of Watts in South LA was hit very hard by this. So really considering this as and this was something actually I shared with my mom, very much of in my consideration for the vaccine, that it was as much the vaccine is as much for the individual as it is for the community. And the idea that overall, yes, we want to protect ourselves from illness. We want to protect ourselves from severe symptoms and death, but we also want to protect others that may have compromised immune systems or may not be able to get vaccinated or may have other complications. We also need to protect them. So that's something that I know I very much considered, and why it was important for me to be involved in this vaccine video, because one of the things we talked about too, things can be politicized often. Science really isn't. when it actually comes to the real science, it really isn't politicized. And if you look deep into it, you can find out a lot of information. I want to make sure one of the things I just saw as a question we haven't, have you heard of any long-term effects that have popped up and been verified?
I have not heard of any long-term complications. The most common serious complication is having a severe anaphylactic reaction where you can't breathe. That is the worst form of that reaction you can have. You might break out in hives and definitely requires emergency treatment. But that can happen, and it usually happens within 30 minutes. But that can happen anytime you put any foreign substance in your body, not just vaccines, but with any medication, because it's a foreign substance. And there have been, some anaphylactic reactions from the vaccine. That's why, you have to go through all those questions. They're trying to, figure out, and the good thing, if it is going to happen, they say most of those severe reactions happen within 30 minutes. But, a reaction can happen 3 or 4 days after you get the vaccine, a severe, adverse reaction. But most of them usually occur within the first 30 minutes of receiving the vaccine.
I know when I got my vaccine and I was waiting, when I made the video, I was like, I'm basically waiting for nothing, hopefully. I mean, I guess that's the goal, really.
I know. You're a good messenger. The community needs you, and, to see people they trust get the immunization. So I'm glad you are a good messenger, so that people who trust you, and then they may want to get it. Hopefully it encourages them to get it as well.
Yes. And I mean, as I've mentioned, and we've had several videos, I'm very real. I'm very honest on these videos. And one of the main things was, as I mentioned it in previous videos, a lot that has been impacting me was protecting my mother through this pandemic. So I did not take the vaccine lightly at all, especially when it came to my mother being vaccinated, more so than myself. So I wanted to make sure to communicate that, but also to make sure you, as an individual, feel comfortable and you do your research, because you will hear just so many things right now, that it is overwhelming. It really is.
It is extremely overwhelming. Sometimes, you can get so overwhelmed where you can read something, but then you got to keep reading because you're not taking anything in. You can get so, the anxiety and overwhelmness can get so high. So yeah, you got to take your time and get that information that's most comfortable, the best way for you. And Adrian is a good messenger, someone you trust.
Let's hope so. So I do want to ask just a couple questions more. Do you have the time?
Sure. Okay. Oh, here's the anaphylactic status. Out of those people, let's see, out of over 167 million doses, they found approximately 2 to 5 people per million vaccinated had a severe allergic reaction, anaphylactic reaction, where you probably couldn't breathe. 2 to 5 people per million.
Wow, that's that's not many in the big scope.
Not many at all. And we look at, because we understand, and I respect everyone who doesn't want to get the vaccine. I do try to encourage, but I respect the opinion because I know it's scary. But we look at this earlier on in my career in vaccines, and this isn't to be cold, but if there's a highway and people keep driving off of it, or a lot of people have just drive off of it, you repair the highway and you keep using it, right? Just we see crashes on the 405 every day, but that doesn't stop us from getting on that highway. You just try to correct it and move on, whatever the issue is. So I hope that helps with the analogy. I hope. As far as vaccines.
Yeah. One of the questions, and this is actually a recent question added. Someone asked about the inflammatory syndrome could you speak a little bit more on that?
Yes, I can. The multi-inflammatory syndrome in children, that's a pretty serious illness. It's a condition that certain parts of the body can become inflamed, such as the heart, the lungs, the kidneys, the brains, the eyes, or the stomach. So when those parts of the body become inflamed, you want to look to see, if your child is feeling sick. And it's really imitating a lot of viral illnesses, the flu. So, if your child gets sick, you definitely want to take them to the hospital to get that checked out. And they'll probably test to see if they have COVID, because children who do have this actual syndrome will require hospitalization and maybe ICU care. Some of the symptoms may have fever, abdominal pain, vomiting, diarrhea, neck pain, a rash, bloodshot eyes, feeling tired. And you have to be aware, just like with the flu, all people may not have the same symptoms. They may have one or all of those symptoms. And, emergency symptoms for the child or anybody, anytime there's any difficulty breathing, chest pain, confusion, just not doing stuff right, inability to wake or stay awake, color doesn't look good, severe abdominal pain, those are always red flags to seek emergency care.
So it's a symptom of COVID.
COVID is causing this multi-system infecting. That's why I understand some of us are really afraid to get the vaccine, but we really need to look at the long-term complications of having the disease. Even in people who don't have any symptoms from the COVID, they're having long-term problems, shortness of breath. They're just not the same. And some people still don't have their taste. They just aren't the same before the pandemic. So, we also need to look at that. What's going to happen to me, the long-term effects of having the COVID infection if we get the infection.
I know someone who wasn't taking it very seriously and now has long-term respiratory.
That's very common. My neighbor, she can't do things in her yard. She's in her 60s. She can't walk upstairs. Yeah, so we need to keep that in mind as well. What are the long-term effects of this infection going to be? And as far as some stats on the multi-inflammatory system in California, let's see. Well, I just got the U.S. stats. I didn't get to pull up California. As of March, I do have California, I'm sorry, and the U.S. As of March 29th, 2021, California has more than 300 cases, which is the largest in the whole U.S. And total cases in the U.S. are 3,185, and total deaths in the U.S. are 36. Wow. So children are dying from this illness.
Wow.
And the best way to protect your child, just like you prevent COVID, mask, social distancing, and hand washing.
That was going to be a follow-up.
Avoid crowded places. On that, we're still in a pandemic, you guys. We're still in a pandemic.
Yeah. Yes, it does seem to be something that society is forgetting on occasion. And
just one more thing, most of these cases were in children between the ages of 1 and 14. The median age was 9. 63% of reported cases have occurred in children who are Hispanic or Latino or Black, non-Hispanic. All of 99% of the cases tested positive for COVID. And more than half the cases, 59% were male. And that's from the US stats overall.
So yes, it's definitely very important for all of us to take care of ourselves during this time. As we've mentioned, we really are about wellness, but that wellness really does include protecting yourself from severe illness and death. And I know that's something, as far as we've discussed trauma and things, losing a loved one is very, very serious. Unfortunately, we've had way too much of it already. So we encourage people to still just take this seriously. Do your research for the vaccine. It's a personal choice. But as I mentioned, it's something to also consider, that the concept of the vaccine is not only for ourselves, but so that we can protect others. With that, and hopefully as we do that, do you have, this will be the final question, do you have any idea, and I know this is, I don't know if you can see the future, maybe you can, but this is all, will be speculation. When do you think we will get back to quote unquote normal?
Man, I'm hoping. And again, based on how things went in 1918, they did it in 24 months, and our technology is way better today, because back in 1918, all they had was the mask and hand washing. And I think they may have done, they probably did some social distancing, but we have way more technology. So I'm hoping it can be a wrap by 2020, next year. This is 2020, by 2022. Okay. Yeah. I'm hoping. But I don't know.
No, it is. And it's so interesting, as you mentioned, just the differences between the previous pandemic, that our medicine is better, but we're also, travel is so much easier.
Oh, yeah. So see, that's going to be, I'm hoping 2022.
Yes.
I hope.
Well, and the good signs, it does seem
like around June, hopefully, before June. Yeah.
Because of the summer. And it seems like a lot of people are getting vaccinated. I hear more and more of large amounts.
You're probably younger than me. I remember when they used to give the smallpox, we would do mass clinics. And I'm 55. So most people in my cohort have this scar from the smallpox. And they would just line us up at school and stick everyone. You didn't question it. You didn't have a right to deny it. We just got it. But I'm hoping this will end by next year. And just listening to Dr. Fauci of CDC, I hope it'll be over in 2022. I trust him. A little bit of background on Dr. Fauci. I used to work with an infectious disease doctor at Cedars-Sinai, and they were good friends. They would communicate all the time, because the doctor I worked with, he was the editor of infectious diseases in children. So they were always communicating. And honestly, he's very similar to the doctor I worked with, his name was Dr. Philip Brunel. And they were like twins. So I knew right away I was going to trust Dr. Fauci. I was going to trust whatever he said. The doctor I worked with was very trustworthy. So the whole time I just, knew what he was saying was accurate. He knows, they're very smart. They know what they're talking about.
I'm glad he's allowed to speak now. So that's okay.
Yes.
So I hope we listen. So I want to thank you again for your time, everything you've been doing during this, but especially
thank you.
To share all this information with us in the community.
It's a pleasure.
I don't know if you have any closing notes. I know I've really enjoyed the conversation.
Yes, I do have a few tips. I thank you. I've enjoyed this conversation too. As far, because I really screwed up on this part. I was so, honestly, when I got the vaccine in December, I was so scared. I know, I was scared. I was terrified. I was just terrified. I just, with everything going on. So what I did, I was being a big baby. I took a few hours before I got my vaccine, I took some ibuprofen so I wouldn't have pain. That's a big no-no. Don't do that, because you may interfere with the protection of the vaccine. It's okay to take it after you get vaccinated if you need it for pain or fever, but never before. Okay, so don't do that. I made that mistake. And also, it is important to get both doses if you do the Pfizer or Moderna. They're either one is 21 days apart, one is 28 days apart. You get your first dose, and then you come back in like 3 weeks for the next dose. If you miss the first dose, they recommend, the second dose, you should get it within 42 days, I believe. Normally, under the principles of vaccination, you don't have to repeat a vaccine. You get the first one of COVID, and it didn't matter how much time lapse, you wouldn't start over, you just get that second one. But because this is a new vaccine, they haven't really studied we try to follow those qualifications. But if you go past the 42 days, I'm sorry if I'm stumbling. If you go past the 42 days for your second dose, why not just get a Johnson?
Okay.
And be done.
Is that possible?
You have up to 42 days between doses. If you can, if you can get the second dose within the 3 weeks, get it. But they say you have up to 42 days. And then in this case, you may have to start over with the first one, or you could just probably get a Janssen.
Okay.
The one dose. Yeah.
So,
keep in mind, all the research is still new. That's why normally we wouldn't start over with a vaccine. You guys understand that?
Yeah.
Under normal circumstances, if I got my my Pfizer, and even if I miss my 3 weeks, even if I miss 42 weeks, I wouldn't get that first one again. I'd start on my second one. I would never repeat. But because of the circumstances that we're under, they say 42 days is permissible when delay is unavoidable, getting that second dose.
Okay. So good to know.
After 42 days, they may want to just give you the Johnson.
Okay.
And, even though they say because of limited research, they don't want you mixing and matching, but they do put a number of 42 days as the limit.
Okay.
So it sounds like you may have to start over again or get a Johnson.
Okay. Good to know. So I want to make sure that's clear for everyone. If you get Pfizer or Moderna, you want to stick with both doses as much. Don't try
mixing and matching.
Yeah, don't try to mix and match them first. What is being shared is if you go past your allotted time for your second dose, you may be required to start the whole vaccination process over. So you may have to get your first shot again, or if the Janssen, which is Johnson & Johnson vaccine is available, you may start that one, which is only one dose. But do not try to jump the line with getting your second dose as Johnson & Johnson and thinking they're the same with your first dose being Moderna. Talk to an expert, let that time fully elapse, and let them make the decision on what is necessary.
Yes, please try to stick to your 21 or 28 days. Please. And get the same vaccine.
Yes.
If you get to do the 2 dose.
Yes. So yes, thank you for your time and everything. I know I've learned a lot too. I did a lot of preparation before, but I just really appreciate learning all this information, and especially just hearing it from like a human voice. I know it's really different than just reading statistics and research and understanding all of that. So thank you. Thank you everybody who has been with us, who has stayed to the end. We really appreciate that. If you can show likes, comments, share. We really also do appreciate that. The more people that do all of those YouTube things, the more people that will actually have the opportunity to see the video. So if this is something that may have helped you, we really do appreciate sharing it, liking it, and letting us know what you think. So thank you once again, everyone. Please.
Thank you, everyone.
Take care of your health, take care of your wellness, and we will see you soon.
Thank you.
Thank you.